Hello everyone. Once again, welcome to virtual platform of Udayanath Autonomous College of Science and Technology, Adaspur. We are continuing our discussion of community health and social work. And in our previous video lecture, we had discussed about the disease caused by bacteria, and we had discussed on what are bacteria, what are the bacterial infection, what are the diseases caused by bacterial infection, and also discussed about what are the cause and risk factors of bacterial infection and what are the symptoms related with bacterial infections. And also we had discussed about how we can avoid, how we can prevent the bacterial infection diseases and how we can reduce the risk factors of bacterial disease. And also we had discussed about what are the specific bacterial diseases. And now in this class we will discuss on different specific bacterial infected diseases and briefly. And first we will discuss about what is diphtheria disease, and we will discuss on briefly about the diphtheria disease, and we will discuss about the what is diphtheria, what are the cause related with diphtheria disease, and what are the risk factors in diphtheria disease, and how the bacteria spread from one person to another person and caused diphtheria disease. And also we will discuss on what are the risk factors of diphtheria disease and how we can diagnose the diphtheria disease and how we can prevent the diphtheria disease. Let's discuss on the disease, that is diphtheria disease, on briefly. First we will discuss about what is diphtheria. Diphtheria is a serious bacterial infection that affects the mucous membranes of the throat and nose, although it spreads easily from one person to another. And diphtheria can be prevented through the use of vaccines. Call your doctor right away if you believe you have diphtheria, and if it's left untreated, it can cause severe damage to your kidneys, nervous system and heart. Diphtheria is a bacterial infection disease and it is also a serious disease, and sometimes diphtheria infected by bacteria, and sometimes some persons are cured from diphtheria disease, and sometimes the diphtheria disease caused different long-term diseases like kidney problems, heart problem, and also caused some another diseases like cancer, damage the person's kidney and heart also. And we can prevent the diphtheria through vaccinated, and diphtheria sometimes a life-threatening disease. Now we will discuss on what causes diphtheria and what are the cause behind the diphtheria disease occurred. The causes are a type of bacteria called Corynebacterium diphtheria causes diphtheria. The condition is typically spread through person to person contact or through contact with objects that have the bacteria in them, such as a cup or used tissue. You may also get diphtheria if you are around an infected person when they sneeze, cough or blow their nose. You have any contact with the infected person or those persons who are infected by the bacteria, that is Corynebacterium diphtheria, and which causes the diphtheria disease, then you will affected by that bacteria and you will be infected through diphtheria bacteria and you will face the diphtheria disease. And when the infected person is sneezing or coughing or blowing their nose, then after that the bacteria transmitted or spread through these activities from one person to another person, and other persons, if they have contact with the infected person, then they are also face the diphtheria disease. Even if an infected person doesn't show any signs or symptoms of diphtheria, they are still able to transmit the bacterial infection for up to 6 weeks after the initial infections. And when a person infected through bacterial infection and which causes the diphtheria disease, the sign and symptom of the diphtheria disease So after some days of the infection and up to 6 weeks after the initial infections, and still able to transmit the bacterial infection from one person to another person before showing the sign and symptom of the diphtheria. And next is the bacteria most commonly infect your nose and throat. Once you are infected, the bacteria release dangerous substances which called toxins, and the toxins spread through your bloodstream and often cause a thick grey coating to form in these areas of the body. And the bacteria always infect your nose and throat, and it infected the bacteria which is dangerous and which is called toxins, and the toxins always spread through the bloodstream and also often cause a thick or grey coating to any areas of the body, and which includes nose, throat, tongue and airway. These are the parts through which the bacteria infected from one person to another person, or the toxins spread through these parts of the body. And next is, in some cases these toxins can also damage other organs including the heart, brain and kidneys. This can lead to potentially life-threatening complications such as myocarditis or inflammation of the heart muscle, paralysis, kidney failure. These are some serious diseases which is related with the diphtheria disease, and in some cases the toxins can damage the cell or organ of the human body, and through which the impact of that or toxins, which include the problems which is related with heart, brain and kidneys, and it infected the different organs of the body and which causes different diseases like paralysis, kidney failure, myocarditis. These are the serious diseases which is related with diphtheria. And next is, what are the risk factors for diphtheria? Means what are the risk situations which is related with diphtheria, and what are the reasons behind diphtheria disease. Children in the United States and Europe are routinely vaccinated against diphtheria, so the condition is rare in these places. In United States and Europe, there is the children are vaccinated regularly and against diphtheria, and due to this vaccination, the people of that area not contact with the bacterial infection which causes diphtheria disease, and they have power, they have capacity to fight with the bacterial infection of diphtheria disease. However, diphtheria is still fairly common in developing countries where immunization rates are low. In these countries, children under age 5 and people over age 60 are particularly at risk of getting diphtheria. Mainly in developing countries, the people are facing and the people are transmitted through the bacterial infection and which causes the diphtheria disease, and due to lack of immunization. And in developing countries, there is also facilities of vaccination for children, and which will help the children for fight with the bacterial infection which causes different disease and also mainly the diphtheria disease. But in our developing countries, it is not working properly, and in our developing countries, the immunization rate is very low. Due to that low condition of immunization, the people are suffering from diphtheria disease. And next is, people are also at an increased risk of contracting diphtheria if they are not up to date on their vaccination. People always increase the risk of contracting of diphtheria, because if the people are not aware about the vaccination, if they are not taking the vaccines, then they can fight with the bacteria. Visit a country that doesn't provide immunization. If the people are visiting any country and in this country there is no facility of immunization and they are not aware about immunization, have an immune system disorder such as AIDS. If the people have immune system disorder and if the people are suffering from HIV/AIDS disease, then the immune system of these persons is very poor condition. Due to the disorder in immune system, they are suffering from diphtheria disease because they can't fight with the bacteria which causes the diphtheria disease. Live in unsanitary or crowded conditions. If the people are living in unsanitary conditions, environment or any crowded environment, and they will face the problem, that is diphtheria, due to unsanitary condition, due to the unhygienic condition of the environment, and which causes the bacterial infection. Signs of diphtheria often appear within 2 to 5 days of the infection occurring. Some people don't experience any symptoms, while others have mild symptoms that are similar to those of the common cold. The most visible and common symptom of diphtheria is a thick grey coating on the throat and tonsils. And there is some different and specific signs of diphtheria disease when a person occurred or when a person has bacterial infection of diphtheria. Then the person's sign is which appear within 2 to 5 days of the infection when the infection is occurring, and some people don't have experience about any symptoms, and there is mild symptoms and which is like a common cold, and sometimes the symptoms are the most visible, and some common symptoms is thick and grey coating throat and tonsils, and throat itching, throat infection problems, common cold problems. These are some specific symptoms of diphtheria disease. Other common symptoms which include a fever, chills, swollen glands in the neck, a loud barking cough, a sore throat, bluish skin, drooling, a general feeling of uneasiness or discomfort. Sometimes some persons have the problem of fever, and they have the problem that is chills, and they have swelling gland in the neck, and sometimes they are coughing for a long time, and throat problem, and they have bluish skin, and also they are feeling uneasiness and feeling discomfort. These are the common symptoms of diphtheria disease. And additional symptoms may occur as the infection progresses, including some additional symptoms which include difficulty breathing or swallowing. Some persons are facing problems in breathing, and they have difficulties in breathing, changes in vision, they have visionary problem, slurred speech, they have problem with speech, and they have problem with throat. Signs of shock such as pale and cold skin, sweating and rapid heartbeat. They have this type of problem. Sometimes some are feeling cold skin, and sometimes some are feeling sweating for a long time, and some have rapid heartbeat, and heartbeat is very speed, and sometimes some persons heartbeat is very slow. They have also some specific symptoms of diphtheria disease. And if you have poor hygiene or live in a tropical area, you may also develop cutaneous diphtheria or diphtheria of the skin. Diphtheria of the skin usually causes ulcers and redness in the affected area. And if you are not living in a hygienic environment, or if you are not living in a tropical area and you have poor condition of environment, then it always develops different bacterial infections, and sometimes some diphtheria have infected the skin of the person, and the skin usually causes ulcers and redness of the skin, and which affected the skin mainly, and this is also a major symptom or infection which progresses the diphtheria disease. Next is how is diphtheria diagnosed, means how we can diagnose the diphtheria disease. Your doctor will likely perform a physical exam to check for swollen lymph nodes. They will also ask you about your medical history and the symptoms you have been having. When you have any symptoms or signs of diphtheria disease, then you have to contact with doctor, and you have to contact with the physician, and you have to diagnose or test your blood or urine or stool which is prescribed by the doctor, and from your medical history, the doctor can note or the doctor can prescribe the medicine, or the doctor can prescribe the different lab tests, and doctor can check for your health history or medical history, and through which we can diagnose the diphtheria disease. And your doctor may believe that you have diphtheria if they see a grey coating on your throat or tonsils. If your doctor needs to confirm the diagnosis, they will take a sample of the affected tissue and send it to a laboratory for testing. A throat culture may also be taken if your doctor suspects diphtheria of the skin. When a doctor suspects you are affected by the diphtheria bacterial infection and you are suffering from diphtheria disease, then the doctor tests your throat or tonsils, and doctor can test through a grey coating on your throat and tonsils, and also doctor needs to confirm the diagnosis, and the doctor can take a sample of the affected tissue, and the doctor can test it in laboratory, and also the throat culture also need, and through which the doctor can confirm about the diphtheria disease, that you are suffering from the diphtheria disease, and the doctor can diagnose through this way. Next is, how is diphtheria treated, means how we can treat the diphtheria disease or how we can prevent the diphtheria disease. Diphtheria is a serious condition, so your doctor will want to treat you quickly and aggressively. Diphtheria is a serious disease, and the doctor always want to treat you quickly and aggressively, because when a patient or when a person is suffering from diphtheria disease and the person is not contact with the doctor immediately and the person is not getting treatment immediately, then the person will face some other diseases like kidney problem, heart problem, and also the person will suffer from different diseases due to the condition of the bacterial infection is very high. And when a person not getting proper treatment at the right time, then the person will face some other diseases, and because of that the doctor always want to cure the disease from right time, and the doctor always want to cure the disease from the primary stage of the disease. And when a person is suffering from diphtheria disease and the person is detecting from the primary stage of that disease, then we can prevent or we can treat that person at the right time, and also we can cure the diphtheria disease. And if we are late for treatment, then we will face some life threatening problems, and we will face some other diseases which are long term disease and which need the long term treatment. So we have to get treatment from the primary stage or from the first stage of the disease. The first step of treatment is an antitoxin injection. This is used to counteract the toxin produced by the bacteria. The first step of the treatment is antitoxin injection, because when a person is infected by the bacteria and which bacteria caused the diphtheria disease and which create the toxins, and through antitoxin injection we can fight with these toxins and we can avoid these toxins, through which we can cure the diphtheria disease. So we need to take antitoxin injections immediately if you are suffering from the diphtheria disease. Make sure to tell your doctor if you suspect you might be allergic to the antitoxin. They may be able to give you small doses of the antitoxin and gradually build up to higher amounts. And always make sure to your doctor if you are suspecting you have any allergy or you have any infection due to antitoxin injection, and if your body is not supporting the antitoxin injection and the body has allergic problem or any infection problem due to antitoxin injections, then please contact with the doctor and share your problems with doctor clearly, and through which you can cure the diphtheria disease. And also, when the doctor will know about the problems with your antitoxin injections and your body is not supporting that injection, then the doctor try to give small quantity of the injection, and the doctor will treat you through any alternative way, through any other ways through which you can cure the diphtheria disease. Your doctor will also prescribe antibiotics such as erythromycin or penicillin to help clear of the infection. Also, sometimes the doctor prescribe different antibiotics and erythromycin or penicillin for cure or prevention of diphtheria disease and for clear the infection. During treatment, your doctor may have you stay in the hospital so you can avoid passing your infection onto others, and they may also prescribe antibiotics for those close to you. Sometimes at the time of treatment, the doctor want to admit the patient, because when the doctor admit the patient, because when the patient is very serious or when the condition or health of the person is very serious or there is any major issues, then the doctor want to admit that patient in the hospital, and through admit in the hospital you can avoid the spread of the bacteria and you can avoid the transmission of the bacteria from you to another person, and through which we can save another life from the bacterial infection and from the diphtheria disease, because diphtheria disease is a serious disease also. Next, we will discuss on how is diphtheria prevented, or how we can prevent or how we can cure the diphtheria disease from the root. Diphtheria is preventable with the use of antibiotics and vaccines. We can prevent the diphtheria disease if we are using or if we will use the antibiotics and vaccines for the prevention of the diphtheria disease. The vaccine for diphtheria is called DTFE. It is usually given in a single shot along with vaccines for pertussis and tetanus, and the DTFE vaccine is administered in a series of 5 shots, and the vaccine is available for prevention of diphtheria disease. And if you are taking the vaccine, that is DTFE, through which you can prevent the diphtheria disease, and this is given in 5 shots. And next is it is given to children at the following ages, trusted source, and the vaccine of diphtheria disease for providing to the children at the following ages, and these following ages are at the 2 months, at the 4 months of the child, at the 6 month of the child, and from 15 to 18 months of the child, and also last is 4 to 6 years of the child. When the child will take these vaccines, then the child will prevent the diphtheria disease, and also the immune system of the body can fight with these bacteria, which bacteria causes the diphtheria disease. And in rare cases, a child might have an allergy reaction to the vaccine. This can result in seizures or hives, which will later go away. Sometimes some children might have allergy or reaction of the vaccine, and it also results seizures, and it also later go away. So we have to mark that child if the child has any allergy or reaction of vaccine, and we have to prevent that allergy or reaction also. And the next is vaccines only last for 10 years. So your child will need to be vaccinated again around age 12, and the vaccines are only given last for 10 years, and so give your child, or your child should be vaccinated again around the age 12. For adults, it is recommended that you get a combined diphtheria, tetanus, pertussis booster shot once, and for adults there is also vaccination for prevention of diphtheria disease. And every 10 years afterward, you will receive the tetanus diphtheria vaccine, and taking these steps can help prevent you or your child from getting diphtheria in the future. And in every 10 years afterward, you will receive the vaccine, that is tetanus diphtheria vaccines, through which you can prevent the diphtheria disease, and also you can fight with the diphtheria virus, and which step can help for prevent you or your child from the diphtheria disease in future. This is all about today's class, and in this class we had discussed about the disease, that is diphtheria disease, and we had discussed about what is diphtheria, what are the causes behind the diphtheria disease, and how the diphtheria disease is transmitted from one person to another person, and what are the risk factors in diphtheria disease, how we can prevent the diphtheria disease, and also we had discussed about how we can diagnose the diphtheria disease, and which will help you to know about briefly on the diphtheria disease. If you have any query, then you can ask me through comment box. Thank you. Keep watching. Have a nice day.